Hi, my name's Gus, and today I'm going to show you the possible pitfalls and things to be aware of when you're trying to bring down a high canine, like we did for Harriet here. But before I do this, every time I post a video, there's one prominent UK dentist who always has to make a comment about my white streak. His name's Prem Semi. So I've got my wife's mascara here, so I'm just going to fix this before we carry on. There we go, much better. Okay, so in Harriet's case, you can see that when we first started, she didn't like this canine on her top left, and we thought, okay, let's do some braces, let's get the canine in the right place. All the staining in between the teeth is just cosmetic, so this is how we started, and here we go. Okay, so here's the case. Let's go all the way back to the beginning, and let's click here. So the main reason she came in was she doesn't like this canine tooth. Everything else is fine, and all this staining in between the teeth is all just a big green tea habit. So we advised having a cleaning done, and then let's look at this in a bit more detail. Okay, so I treated this case back in 2015, and it was a bit of a learning curve because something which I wasn't expecting happened, but hopefully when we're going through this case now, you'll see that happening beforehand. But this tooth here is too high, so it needs to be brought down. It's also rotated, and there's not enough room for it. So let's have a look at the occlusal, and then we'll see that in a bit more detail. So there we go, this is the occlusal. So you can see that it's rotated, I wouldn't say 90, but it's not far off. And this distance from here to here is shorter than this distance from here to here. So to keep the incisors in roughly the same position, we're going to need maybe 2 to 3 millimeters of room somehow. So I actually got that from IPR, but that's what I wasn't actually expecting in this case. I mean, it sounds stupid, but I just got so fixated on the rotation and the fact that this was a bit higher up. I thought, yeah, we can sort this out really easily. So let me show you what happened and the slightly unexpected side effects. So I'll just get on with how I sorted the rotation out, because this I was pretty proud of. And we got the brace on like normal, started probably with a 14, 16, 18 night eye, something like that. And you can see that the wire is going in here, and then it kinks out there and then goes out there. So we've got this quick tie on there holding the wire in properly, and it's this little kink here which is actually forcing this tooth into a much better position. But coupled with that, we have this here. So we've got two, they're like composite stops. You get this composite mold kit, and you can just make these. And then we've got some power chain. So the power chain is pulling that way, and it's pulling that way as well. So you want something strong to anchor again. So we've just used the 6 here. But the result here is that this tooth is going to derotate that way, because that's happening from that side, and this side is going there. So you're getting a derotation of this tooth, which is exactly what we want. So as you can see in this photo, it's so much better than where we started from. So that's the derotation bit sorted out. Now let's have a look at what happened a few months in. So this is the same appointment, just the front on view, and you can see that this side is so much higher than this side, and we've got a nice little occlusal cant which we didn't have before. So the reason for this, and I was expecting this a little bit actually, this is the most obvious thing that I missed out. It's because the canine is coming down, and the canine's a nice big heavy tooth. What that's going to do is actually pull everything else up. And that's why everything on this side is pretty much as it was right at the beginning, but then instead of having a nice flat incisal edge, everything's now canted. So the way around this actually is just keep the faith. Right, just keep the wires in, and we went all the way up to, like, I think it was an 1825 steel wire, so a nice stiff wire. And what that does, because the molars and premolars up here are in the right plane, it actually just levels everything out Not like that, but it levels everything out so it looks nice all the way to the end. So let's just quickly go to the final photos. Okay, so this is the end result, and you can see that everything looks pretty good, and the occlusal cant has been sorted out. Okay, and I didn't do anything special. No, it was just staying in the wires for a bit longer, and I made sure we were in stainless steel wires. There wasn't any wire bending or anything like that. So the thing that I actually missed out on is the proclination of the teeth. So that extra 2 or 3 millimeters, I thought this was going to be a case without any IPR. I was wrong. The teeth all proclined a little bit, but as they proclined and they became straight, it became easier to do the IPR in between the teeth. So that's when we did it. So we brought them out and then pulled them back in with power chain. And that's called round tripping. So we did that. End result, she's happy. So at the end, like always, we put in a retainer, and the reason I've gone up to the 3 on this side is because this is the tooth which had all the problems. This had the rotations and it was high, so I just wanted to get that stuck in, and on this side I didn't because it was just too difficult to avoid the occlusion on it. So that's why I've extended it from the front 5 teeth, and then removable retainer on the top as well. So it's been more than a year since we finished her treatment, and apart from the retainer reviews, I haven't seen her, so I'm assuming she's happy with everything. Great, so I hope you got something out of that video. If you did, please like it and share it. It helps other people see it, and I'll try and keep more cases coming. See you next time.